tell me about your specialty, exactly what you do, what's your main interest?
So I'm basically a hematologist, hemato-oncologist, and bone marrow transplant specialist. We are two people, Dr. Vikas Dua and me. Dr. Vikas Dua sees from 0 to 18 years of age, and I see from 18 to till the time you're alive, any hematological disorder which comes in.
I know that you also, among the disease that you are treating multiple sclerosis. And there is another disease that it's not the same, but the amyotrophic lateral sclerosis. People calling me for these two pathology, and I told them it's not the same. People, they are saying that it might have another treatment like stem cell treatment. You have to tell us the difference between the multiple sclerosis, which call in French sclérose en plaques, et l'amyotrophic lateral sclerosis, amyotrophic lateral sclerosis. So tell me exactly the difference between them and why one is accepting to have like a stem cell and the other no.
So multiple sclerosis is an autoimmune disorder, dear friend, where your own body cells are killing the neurons, leading to the loss of function because of the death of those neurons or the brain cells or the brain waves or you say the neurons, what you call as. While amyotrophic lateral sclerosis, or what is called as ALS, is a degenerative disorder. It's not an autoimmune disorder. It's a degenerative disorder in which the cells have started dying because something inside the cell has gone bad and they are not able to survive. Why multiple sclerosis? Because these are autoimmune in nature. I can bring an external agent and remove the autoimmunity. But in ALS, because of the degenerative its nature, I cannot fix the cell. And remember, stem cell transplant is not stem cell therapy. Stem cell therapy is where you take the stem cells from somewhere and inject either in the spinal cord or in the knee or in the heart or in the brain, thinking that these cells will grow into those respective cells. So that does not happen. And bone marrow transplant is in multiple sclerosis, specifically what is called as autoimmune disorders like systemic sclerosis or multiple sclerosis, Crohn's disease, rheumatoid arthritis, SLE. These are the autoimmune disorders. I bring an agent which suppresses the body's immune system, take the stem cells, suppress the immune body system, kill the B and T cells, and put the stem cells back in, allowing these stem cells into the milieu of these immunosuppressive agents to grow normally. So dear friends, MS is amenable by bone marrow transplant, 80% success of stopping, and after that, no medication. It is just that the disability should not happen. If you lose your eyes, I cannot bring that eye back. I can stop that eye from getting bad to worse, but I cannot make it bad to good unless you come to me early. So that is why we are saying that multiple sclerosis from across Europe, across US, and it's not expensive. It's not crazy expensive. And you can get it done safely with the same protocol which Dr. Richard Bird has used. Rituximab, cyclophosphamide, cetoxan, and ATG, which can be utilized, adopted, 110 patients done, and 80% success. So please remember, degenerative disorders like Parkinsonism, ALS, Duchenne's, they're not amenable to stem cell therapy. But autoimmune disorders, yes, we should try to get the transplant early, because ultimately what are the other drugs doing? They're all suppressing your immune system and continuing the drugs forever. While in bone marrow transplant, it's a one-time procedure.
Yeah.
So I think MS should be amenable for transplant, and we should adopt early rather than late.
Yeah, my question comes after seeing a patient. He was bringing an opinion from a doctor in, I don't know exactly from where, and they were telling them, yes, we can do in ILS, we can do the stem cell. I told him no. I heard something from Dr. Rahul. We cannot do this. It's not like, and then you just explain now why it's different. So I'm just preventing people not to go, jump, just for money and throwing their money.
Absolutely.